Pain. We all know pain. It's an unpleasant physical sensation that we experience when something is wrong in our body. At least that's how we think about it. But for so many people, pain becomes a persistent and even daily reality, regardless of whether or not there is any detectable underlying cause. Too often, doctors resort to prescribing medications in an attempt to manage people's pain. Or what's more common these days is to recommend mindful practices and stress relief and yoga. If you're the one with pain, meditation is probably not the solution you're looking for. Recent research shows that there is a better way. And I know this to be true because I see it every day in my practice, and it's how I found my own way out of pain. That way is, wait for it, neuroplasticity. In this video, we'll explore the link between neuroplasticity and pain, how pain can actually change your brain for the worse, and some of the potential caveats that are part of the complexity of your brain and pain. Hi, I'm Adrienne Pennebrae. I help folks who are seeking wellness to recover movement freedom so they can live with more vitality and less limitations. I'm a movement specialist and practitioner of the Anat Baniel method of NeuroMovement. So what does persistent pain have to do with your brain? Your brain is constantly sending signals to your body, and pain is one of those signals. When you experience pain, it's because your brain has determined that it's important for you to pay attention to something, and that something is anything your brain perceives as a threat. Pain is personal. That's why different people can experience pain in different ways. It's all based on what your brain perceives as dangerous to your safety. Past and present traumas, injuries, stress, all play a role in how your brain perceives danger and safety. Your personal experiences, including your thoughts, your emotions, and your physical responses associated with your experience, shape your very own unique and personal brain landscape. Pain makes a big old imprint on your neural mapping. Here's an interesting little story about the connection between pain and experience. In the 1970s, a rehab physician at New York University named Dr. John Sarno developed an entirely new method for treating back pain, focusing on the mind and emotions rather than the physical cause of the discomfort. Drawing on his extensive experience with many years of patients, he hypothesized that emotional stress or trauma was at the root of many causes of chronic lower back pain. He proposed that when people repress anger and other intense emotions, their bodies find ways to release them, such as through muscular tension, which can manifest as discomfort in key areas of the body, such as the lower back. His revolutionary ideas paved the way for a different kind of treatment aimed at addressing both emotional and physical aspects of human ailments. And he inspired practitioners all over the world to use his framework in their practice. Today, his theories are still regarded as innovative, but also crucially important in helping people manage chronic pain from both a mental and physical standpoint. As I like to say in my practice, it's all connected. It's important to know that pain is 100% brain generated, which means that what you feel as pain is an internally generated reaction that's happening like in here and not necessarily an accurate reflection of what's happening out there. It's weird to think about, but see if you can imagine this. The pain you sense in your arm or your hip or your back or your shoulder or your neck is the result of an internal communication process. Here's how it works. A danger alarm signal is sent from receptors in your body tissues to your spinal cord by special neurons called nociceptors. Once the brain receives the alarm, It controls the volume knob on pain, turning it up or down. Ultimately, the brain decides how to tune in the pain signal, how loud and for how long. The sensation of persistent pain doesn't necessarily mean you're falling apart, you need surgery, or you have a disease, although it certainly can mean those things. What we can say about pain is that it's your brain's way of telling you to do something differently. It's a distress signal, telling you what you're doing now is not working. As my mentor, Anat Banyel, likes to say, how much evidence do you need before you know it is so? In the next video, I'm going to talk about how persistent pain can actually change your brain for the worse. That's the dark side of neuroplasticity. Stay tuned. If you're enjoying the content here on Movie Show, did you know you can sign up to be on our exclusive movie A-list? Go to the link to subscribe at moviestudio.com. We've got personal experiments happening every week that you can join in on. That way, you won't miss out on getting your one good thing you can put to use right away to change your habits, your brain, and your life. Plus, we'll give you updates on all things just for our followers. You're worthy of moving into a meaningful, enjoyable life. We're here to help you do it.